I'm the owner of Dave's Soda in Pet City. Yes, I sell soda and I sell pet food, a four-store business in the greater Springfield, Massachusetts. My business has been named the Greater Springfield Chamber of Commerce Small Business of the Year. We are the habitual winners of the People's Choice Award. We sponsor every Little League team. We sponsor every church, every cheerleader, everything that has anything to do civically in Western Massachusetts, we're involved with. I'm sure that all of you in your communities have a business like Dave, and I'm in the 20 to 99 employee group that is really nervous about what's going on. The retail industry, as you know, is one of the biggest supporters of the employer-based health insurance system, despite not having an easy workforce to cover. We are strong supporters of health coverage in spite of these challenges. It's not that we don't want health care for everybody, we just want to do it right and equitably. As an industry that frequently endures wafer-thin profit margins, we're also well acquainted with the need to manage the collective costs of labor as in an effective manner as possible. And maintaining the balance between these two imperatives is not always easy. It's borderline impossible, as you said, even in the best of times. And Lord knows these ain't the best of times. We hope to work with you and other members of the U.S. House and Senate to bring about a meaningful relief from the rising health care costs. And to be honest, I'm almost like elated to just hear you two talk about what you think. It's fabulous. The key in our view is to reaching universal health care is maintaining or getting rid of the high costs. The NRF has proposed a comprehensive solution to increasing access to more affordable health coverage in our vision of health care reform, and I ask that it be included at the end of my written testimony. I'd like to touch on just a couple of points. Retailers who don't offer consistent value to their customers simply don't survive. Amazingly, the same is not true in our healthcare system. We need to develop a consumer-friendly comparative cost and quality information. My customers know more about the pet products on my shelves than they do about the doctors or the health plans that they do. People should be able to select the best quality care just as they choose between me and my competitors on a daily basis. And you do need competitors in order to have real competition. This was the first year in 20 years when my renewal came up that my health care costs didn't go up at least 15%. Why? Because there was a new legitimate player that came into Western Mass, and they came in with a better plan at the same rate. It's amazing. Auto insurance in Massachusetts, when they finally let that get competitive, auto rates went way down. It's really about good competition. Reducing the health care cost should be a central goal in all health care reform. Employer mandates, as you said, they add costs. The NRF particularly looks forward to working with the committee on the chairwoman's proposal to create a market for high-risk claims. I think it's a fabulous idea. When it comes to increasing access to coverage, we believe that we can reach universal coverage without mandating that employers provide coverage. The problem with employer mandates, either to provide coverage or to provide specific coverages, is they directly increase the coverage and hence the cost of labor. Here's the real-world deal. It will kill jobs. Employers simply will not bring on new employees if they get mandated. Just basic common sense. Employer-mandated health insurance will leave everybody unhappy and a ton of people unemployed. And who's going to pay the doctor bills if these people don't have jobs? Yes, we urge policymakers to be wary about doing what Massachusetts did. I will tell you, it did not work. Rates have skyrocketed, and many people are still unemployed. It didn't work. And I understand one of the biggest challenges you will face will be building a consensus around the reform, and I would venture to guess that there isn't an industry or any American who doesn't have an idea about how it should be done. We hope that the NRF vision will help add to the growing consensus around reform, and it's time to get it done now. And only the right reforms enacted into law. I thank the committee. I look forward to your questions, and I am so elated to hear what you guys are saying.